Good morning, everyone. It's wonderful to be here with you today. I'll be presenting on behalf of my colleague, Dinesh Murthy, who's also with NuMERAL. He really wishes he could be here with you today. He's talked about it a lot, but I'm very honored to have the opportunity to spend this time with you. All right, so today we're going to be talking about a tool called the District Assessment Tool for Anemia. It stands for DATA, which is very relevant to this group here today. And really the aim of this session is going to be to get the group to think about what kind of data is really needed to prioritize anemia actions. And then the second thing is you'll actually have an opportunity to think about the barriers in your country to addressing and interventions that will address the underlying causes of anemia. Next slide. Okay. So the purpose of data is really to increase the understanding about anemia and its causes in your context, to highlight what is the current data that you have available that you can use, and also to identify where you may have data gaps. And lastly, to use the data that you do have to prioritize activities to address anemia. So the data tool is intended to be a 2-day workshop with practitioners across multiple sectors. It's actually been tested with some of our colleagues in this room from Uganda and also from Ghana. And so essentially it brings together people to discuss 5 different steps that they take to prioritize action. So the first is you review your anemia situation, which is provided in the overview dashboard of the tool. And this also includes the causes of anemia in your setting. The second step is you review the programs and policies that exist in your country in another tab, which is called the Findings dashboard. The third step is you discuss the outputs from these dashboards, and you also start to think about what are potential barriers to improving the success of the programs that you are implementing. And during this stage, you really talk about what are the inputs required for a successful program. And then in step 4, you actually work as a group to identify what the barriers are in your setting. And you'll have the opportunity to do that today. And then the very last step is about formulating a plan of action. Oh, sorry, next slide. Thanks. And then the very last step is about formulating a plan for action. Next slide, please. So let's kind of go into each of these steps. So at the first step, where you review your situation on anemia, there's a national questionnaire that's comprised of questions around what is the prevalence in your setting, what's the level of iron deficiency, vitamin A deficiency, what's the status of what policies you currently have in your country. And you've all shared this data with us, and Dinesh has actually inputted it already for you into the tool that you'll be using today. The second questionnaire that is used is one that's at the district level. And this one includes what is the anemia prevalence in your district, what are the causes of anemia in your district, and also asks a series of questions on policies, what programs exist in your district, and what is the coverage of those programs. Because not all districts are going to have data at that granular of a level. At this stage, there's actually an option to put in quantitative data, but also qualitative data. Next slide. There's also a discussion that is had among the group during the workshop around the different sources of data that are being used within the dashboard. And the group really talks about what are the strengths, what are the weaknesses, based on the data source you are using, how should you interpret that data. Next slide, please. Okay, so this is what it looks like, and you're going to get to see the dashboard for your country today. So the first thing is the overview dashboard. And you can see it shows the prevalence of anemia. It shows the causes of anemia. And at the bottom, it just highlights the roles different sectors can play in addressing anemia. Next slide. Then at step 3, after you've reviewed that dashboard, you start talking about the barriers to implementation. And these are the inputs that you will discuss. So commodities, funding, provider skills training, client demand. So those are all things you'll talk about today in regard to your interventions at the national level. Step 4. You then will directly in the tool that we have for you, you will input, no, there's no barrier for this particular issue like commodities, or there's somewhat of a barrier, or it's very much a barrier in my setting. Next slide. This is going to be the dashboard where you input those barriers. So what you'll see on the right is all the interventions that exist in the district. In this case, it will be all the interventions that exist in your country that you've already given us data for, and so it's already been filled out. And then on the right side is the barriers, and that's what you'll be inputting today. So you'll be going through each of these interventions and saying what types of inputs are issues for that intervention. And there's 2 ways you could look at it. So you could look at it horizontally, in which you're looking at a single intervention and you're thinking about all the barriers for that intervention. Or after you filled it out, you could look at it vertically and think about what inputs are the biggest challenge in a given setting. So are you finding commodities as your biggest input, or is it provider skill that's your biggest issue across interventions? Next one, yeah. Then we move on to step 5, and this is when you really formulate your plan of action. And we don't have time to do this today, but I know everyone's going to go back home with lots of ideas of actions they could take to address anemia. Okay, next slide. So in addition to the district assessment tool for anemia, there's also a national tool that can be used by countries. We're not using that one today because it doesn't include the barriers section. So some of the key differences between these 2 tools is the landscape tool actually has directly in it a place where you enter the data source, and that is not the case in the district tool. It also has a module on genetic red blood cell disorders as a potential cause in your country, which is not in the district tool. And it also has a section where you can enter information about your country from a regional level. So these tools can be found on the USAID Spring website, which was a project about a decade ago that developed this tool, but the tools are still available for use. And in addition to the tools themselves, there's also facilitator guides. So if you want to use this tool in your country, you can use those facilitator guides to train people on it and also to carry out workshops. All right, we're about to get into the session work. But while I'm up here on stage and I have all of your attention, I did want to make one announcement about NuMERAL, which is a new USAID-funded project, and we're going to be supporting local organizations to do research, monitoring, and evaluation. And the way we're going to be doing this is through sub-awards that are released through requests for expressions of interest. And in 1 week's time, we'll be releasing the first request for expression of interest. So if any local organizations are potentially interested in doing research on nutrition and on responsive care and early learning within the health system, please come talk to me or to Jackie, my colleague at APHRC, who's a member of the NuMERAL consortium. All right, so let's get started now, next slide, on our action. So you should have received an email, either from Marty or Manuela, with your district tool that's already been filled out to download. Most of you received that email yesterday, but some of you received it today. So Kenya and Nigeria, you will have just received it this morning. You received it from both Manuela and Marty, but it's the same tool. They're very on top of things. And then Senegal and Uganda, your district tools have been updated since the initial email, so you'll want to download the version today. I'm sure not everyone has a computer, but as long as one person has a computer from your country, you could all kind of stand around that computer. If any groups do not have a computer, just raise your hand and you could borrow mine or somebody else's. If you have any trouble downloading the tool, also please raise your hand. And once you start using the tool, if you have any questions, we'll be going around to help you with the exercise. At your table, there's a sheet that looks like this, and it provides instructions on how to do the exercise. You'll have about 30 minutes for this work. So the first 10 minutes you'll really want to spend looking at the overview dashboard, the one that looks like this, and discussing the situation in your country. Slide 9, please. So you'll spend about 10 minutes reviewing the data from your tool here. Then if you go to slide 12, you'll spend the next 10 minutes here in which you'll be talking about the barriers, and you'll actually be inputting directly into the tool the results for your barriers. And if you'd like, you could send us your tool once you've completed it. So we have all the completed tools. And then in the last 10 minutes, you could spend some time just really thinking about what were some of the challenges with using this tool? What were things that you thought were helpful? But also, is there certain data that you didn't have? Is there certain things that you wish were in the tool that made it hard for you to kind of interpret the anemia situation in your country? When looking at this exercise sheet, there's also a number of questions that you can think about and discuss as a group. So we're going to go ahead and start the breakout for that, and please raise your hand if you have any issues accessing the tool.